All right. Good morning, everybody. Thank you for joining us for our recertification training for the OHA Community Partner Outreach Program. We are happy to be with you today. And if you are here, it's because, presumably, you are a certified assister with an active assister ID, and you're here to take your yearly recertification so that you can continue to do assistance with Oregon Public Medical programs for the next year. If you're not a certified assister and you need the full training, this is not the one for you. You can contact our business team. The email address is on the screen, cp.business@dhsoha.state.or.us, and they will help you get set up with the proper training. Today we have 3 people that are assisting you. Myself, Deanna Simon, I'm a regional outreach coordinator for Multnomah and Clackamas counties. We also have John McDade and Jessica Diaz. Jessica is here with us right now, and then John will join us in a little bit. And they are both on statewide projects, which I put in just to be general. Jessica, did you want to say anything else?
Yeah, just hello, and I think John might be here too.
Yes, John is here. Hello, everyone.
Excellent. Good morning, John McDade.
Good morning, Deanna. Good morning, Jessica. What a delight to be here with you guys today to do this awesome training.
Right. So, John, we are recording today just in case anybody needs to listen to a recert later and we don't have any available just to fill in any emergency needs. And I'd like to point out your beautiful headshot that's there on the screen. That's what I could find in our system this morning. So we have John, the blue blockhead, and Jessica and Deanna for you.
That's all right. I've been referred to a blue blockhead before, so not the first time.
Darn, I was hoping I was the first. Okay. Jessica, we have somebody who's trying to call in. I'm presuming that you're sending them the phone number connection from webinar. I'm not sure it shows in their webinar screen necessarily.
But are you getting personal messages? Okay, no, looks like we've resolved it.
Excellent. Okay. Let's see. So Jessica and John, actually Jessica is here, was here to fill in for John. Now that John's here, Jessica may drop off, quite possibly. And we'll just let them figure that one out. So this is a required training for all ongoing Oregon Health Plan assisters. And this is whether you're a grantee or with a volunteer organization. So we just want to make sure you know that this is that training that we've been telling you about, saying make sure you take it so that you can keep your assister ID. So after today, you will be set on your yearly recertification. It seems like everybody has located the orange box for the control panel of the webinar. I also want to point out that in that control panel, you have a handouts section, and you have 4 different handouts that I have uploaded. I really encourage you to download them. 3 of them are the same as what I sent you in the reminder email. The 4th one is the slides to this recertification training that you can use as a resource if you would like. We are muting everybody today because we have more than 50 people on this training. So if you want to communicate with us, please use that questions box. It seems like most of you are already there. And we are going to be asking you at various points to engage with the questions box. And we're going to be asking you to look things up and type answers into the questions box. So we want you to stay as engaged as possible. In fact, along the way, if you have questions, we want you to ask them as soon as they arise for you. And we will then pause at various times to answer those questions. But don't wait until the end. Just send them off as soon as you have them. We want to make sure you're getting all of your questions answered and we don't miss anything. All right, John, did you want to say anything else before we move on?
Nope, that sounds great. I am looking forward, though, to engagement from folks and hope that it's a valuable training for you today.
Great. So the first person we wanted to introduce who is not here with us today, her name is Jamie Vineyard. And Jamie Vineyard right now is the face of our business team. She also has other supports. But when you write to cp.business, you are communicating first with Jamie and then now with some other folks that we have on our team. So Jamie will help you with all of your things, such as if you have any questions about your assister ID, access to the One portal, and other business stuff. And we are, however, one big team. We all know each other very well, and there is truly no wrong door. So if you reach out to any of your support folks, so your regional outreach coordinator or the business team, we'll just funnel you to the right person, regardless of what your question is. Each of you also has a regional outreach coordinator. And for some of you, I'm your regional outreach coordinator. And for some of you, you have a different coordinator. I want to make sure everybody knows their coordinator and is connected, because in these virtual training environments, you might have trained with somebody who wasn't your ROC. And so you might not know your ROC very well, but we want you to call up your ROC, introduce yourself, and say, hi, I'm one of your new assisters in your region. Even if you're not new and you've been part of this network for a year and a half, but you haven't really met your ROC, please reach out. So in the Getting Started guide, there is a list of all of the ROCs, and this is going to be the start of you accessing your documents. So I want to make sure that everybody has their Getting Started guide ready, because we will be referring to it and asking you to go look up things in it. It is sent to you in the email reminder for this training, as well as in the handout section. Once you have it up, can you please let us know in the questions box that you have it? Or if you need help finding it, please let us know that too. I'm going to pause. I see 2 people have it. 3 out of 55.
Look at that. Nice.
Okay. Excellent. Now, what I personally do, and some other people do in my region, is we print it out. I know it's long, but we print it out. We put each page into a page protector, and we put it into a 3-ring notebook. That becomes my desk manual. And I actually like looking at it in the hard copy version. So I just wanted to mention it in case that's useful to anybody. I think it's incredibly useful, but at least you all have it electronically. If it's on your phone, it might be pretty small, but that's okay. I'm sure you will be flexible and you will make it work. All right. What I want you to do is look up your regional outreach coordinator. And actually, I'm just curious. Give me a read. Can you type into the questions box, yes, I know my ROC, or no, I don't know my ROC? And I'm not trying to, call anybody out. In fact, nobody else will see your answers except John and Jessica and I. I just want to know in general, under these remote training conditions, how many people are actually getting connected to their ROC or not? Okay, right now, it is.
This is helpful information.
Yeah.
Yeah.
There's definitely a handful of people who don't know their regional outreach coordinator. So I am glad I asked. What I would like you all to do is go to your Getting Started guide and look for page 2627. In fact, I will go there with you.
This is thank you for asking that, Deanna. Just because as you do this work, depending whether you do it day in and day out or whether you do it on occasion, depending on how your work site is set up, it's just always know that you have one of your lifelines is your regional outreach coordinator or your ROC. And it's just nice to sort of begin to build that relationship and to reach out to them. They're only an email or a text away or a phone call away. So do not be bashful to reach out to them when you're stuck, you're not quite sure what an answer is. They can be one of your resources.
All right, I'm going to open up an old version of the Getting Started guide because that's for some reason what I have available to me at the moment. But it should be basically the same except for one resource. Page 2627, I'll go up here and just do a quick jump to it. Aha! Oops, it's actually a little bit before that maybe. There we go. I guess the pages are a little bit different. Okay, here are your ROCs. Can everybody who doesn't know who their ROC is, look on here, figure out who your regional outreach coordinator is, and just type their first name into the questions box. So
and I think it's page 22 for a lot of folks.
Yeah, page 22 is the map.
23.
And then 23 is where you get the list and you can see their photo and you get all their contact information. Depends on which way you like to look at it.
Now, did I make it out of the blue blockhead in this document?
I believe so, but I think you made it out of blue blockhead in this document. Look at that. There's John McDade.
A handsome devil, that
really
guy.
Big. Where are you? There's John.
Oh.
You're
Yep.
A little pixelated, but looking fabulous nonetheless.
Yes. Devilishly handsome.
All right, so have people found their regional outreach coordinator? Okay.
I am seeing yes.
So if anybody missed that statement, what I want you to do is I want you to go to page 23 in your Getting Started guide and find your rock if you don't know who they are and type in the name of your rock into the questions box. And now I'm going to look for a commitment. I want you guys to send your rock an email or send them a text or give them a phone call and introduce yourself because we are here to support you. I have rocks that, I have CPs, community partners that contact me every week to troubleshoot some of their complex cases. Especially when you're new and getting used to this work, it takes a long time to figure it out, and we are here to help you navigate the system and help you know your resources. So please reach out. Now, you do have two sets of rocks. So somebody just typed in their Oregon Health Insurance Marketplace Outreach Coordinator.
Oh,
And that's
yes.
valuable too. So let's scroll out, make John a little smaller.
Thank you.
And the second group of regional outreach coordinators is the marketplace coordinators. And I think it's important to make the distinction. John and Jessica and I are on your Oregon Health Authority Community Partner Outreach Program team. We help you with all things related to applicant portal and Oregon Health Plan. So if you're trying to access the applicant portal or you have questions about Oregon Health Plan applications, eligibility, navigation, that's us. But if your applicants end up being eligible not for OHP or anything in the one system, but eligible for a marketplace plan and you need assistance with that system, that's when you go to your marketplace regional outreach coordinator. Did you want to say anything else about that, John?
No, I think that's really well, and like to make that distinction, because you want to go to whoever is really the expert on sort of which side, whether it's private marketplace or OHP, and so knowing that distinction and where to go should save you some time.
Absolutely. And each of the teams have different connections. So we're very connected at the OHA side to the eligibility teams and the processing teams and the Medicaid policy teams, and your OHIM coordinator is connected to the marketplace and all of those resources. Because it really is about who you know.
Yeah, and we work closely together as well with the OHIM team, but oftentimes if I get a question about marketplace, I will refer you to the appropriate person over at the marketplace.
Absolutely. Okay, we are going to take a break today, about a 10 to 15 minute break sometime in the middle. John, I'm thinking that I can go through rights and responsibilities and you can pick up after that. Does that sound good?
That sounds great.
Right. I'm just going to launch in. I guess I'll let you know. We're going to cover the new upgraded integrated one system. We're going to talk about some new guidance about removing household members. We are definitely going to talk about rights and responsibilities and notice of privacy practices. And if that is new to you, that's okay and that's good. You need to be here listening to it. If it's not new to you, you can ask any questions you have. We'll talk about a new updated consent form. We'll give you a tour of a revamped group site. We will share with you all the learning opportunities we've created because it is very, very different than what we had available for you a year and a half or 2 years ago, last time you took your recertification. We'll show you some guides and resources, the escalation process, and plenty of time for question and answer. Before we launch into all of the technical stuff, we want to pause and say that you as community partners do an incredible amount of work for our communities. You help Oregonians not just get health coverage, you help them keep their health coverage, and many of you, and I'd even say most of you, are going through extra steps to help them utilize their health coverage benefits. And that makes a huge difference for individuals and families and communities. We exist to support you. And so we wanted to take this moment to really acknowledge all the work that you do and share our deep appreciation for the difference that you make, especially during the pandemic, which has not always been easy. So a moment of gratitude. Thank you. And now we want everybody to recognize that you are part of a really big network. We have over 1,600 community partners working in the one system to help people apply for health coverage. serving over 81 languages. And in all, if you look in the one system, about 30% of individuals with coverage have been assisted by one of our community partners in this network. Some of you are public facing and help anybody who walks in the door. Others only help your organization and your clients. But together you make up a very, very powerful network. And part of what you use in order to create this big difference is something called the ONE system. ONE stands for Oregon Eligibility. And this ONE system, I'm guessing most of you know at this point, is upgraded. It's called the upgraded ONE system. It brings all of the Oregon Department of Human Services programs together in a single financial eligibility system. What that means is that people don't have to apply in multiple different places anymore. They can just apply in one place. That's a little bit not true. All of their information for all of their cases is housed in one place, but you as community partners are only helping them apply for medical coverage. But when you help them apply for medical coverage, all their information is in one, and when they go to finish their application at a local DHS office, they can pick up from where you left off and just add information to finish applying for the other programs. And all those other programs that live inside of the ONE system are, now it's all the medical, so Magi and non-Magi, and you can help people apply for that full range of medical. It's employment-related daycare, refugee cash assistance, additional refugee medical assistance, SNAP food benefits, and cash benefits, which is TANF, temporary assistance for needy families. Now, something I want to mention that many of you know, but if you're newer, you might still be wrapping your head around it. And it's this first bullet here, medical programs, including Magi and non-Magi. It used to be that if somebody was 65 or over or disabled, receiving SSI, you would have to send them over to an APD office to apply for medical coverage. That is no longer the case. Anybody who's looking for Oregon Public Medical, who's under 65, over 65, disabled, not disabled, receiving Medicare, not receiving Medicare, they all apply through this system, through you. So you should be helping anybody and everybody apply for medical assistance, regardless of what their demographics are. So I want to pause there, ask John if he has anything to chime in about, or see if there are any questions to be addressing from the questions box.
We do not have any questions in the chat box at this time, and I think you've covered it really well.
All right, moving on. The piece that I want to point out in this is the third bullet, which is that Oregonians can apply for benefits in multiple ways. And the fourth bullet, which is that when they do that, they are potentially reaching eligibility workers from across the state. It used to be that all the eligibility workers sat in big cubicle farms, for lack of a better term, in Salem. And now that is not the case. It is distributed. The eligibility worker staff and tasks are distributed throughout the state. And Oregonians can apply for benefits by calling. They can go to one.oregon.gov and apply online. They can go to a community partner. They can go to any local DHS office and apply for all of the medical benefits. That means they can even go to a local DHS office and apply for regular Magi Medicaid. They didn't used to be able to do that, so that's a big change. Phone applications are always still available for anybody who has trouble accessing the application in any other way. And it can be really great for somebody with language barriers or with an incredibly urgent case that doesn't have time to wait for other processing timelines. I think that's really, that's something that we wanted people to understand, is that this body of work is both integrated into one system and distributed across the state so that we are working toward the no wrong door concept, and we are getting there. Righty. And now I'm going to launch into something a bit technical about the applicant portal. What we are trying to do in this recertification is give you tidbits that are really relevant, that are updates and aren't just a regurgitation of stuff you already know. Now, if you're a very seasoned assister, you might know a lot of this, but we are trying to throw in some extra pieces as well. So here's a piece that we want to make sure everybody knows that isn't necessarily in your main training, depending on when you took it, and it's pretty important. For household members who are receiving non-medical benefits like SNAP benefits, we need to make sure not to remove any household members from the medical cases. And the reason, and I'll kind of outline it, the reason is that different programs define households differently. So an example is that SNAP benefits will consider a roommate part of your household because you're sharing a kitchen. But medical household considers a roommate a separate household and completely different. So if you have two roommates that are on the same case and you think to yourself, oh, I know enough about Medicaid eligibility, that roommate shouldn't be on this medical case. Let's remove that roommate. Well, you'll also be removing them from the SNAP case if you do that. So we don't want you to remove people from the applicant portal if you think they might have other benefits. The way to do it would be to call a worker or send in an email to your Oregon.benefits email team and have a worker do it, because workers accessing the worker portal window or door into the one system have different permissions, and they can remove that person from one case but not from another. So removing household members, proceed with caution. If they have other benefits, go through a worker, an eligibility worker. Now, the other change we don't recommend reporting in the applicant portal is a change of address. The reason for this is that any change logged in the applicant portal is handled as an eligibility change. It will rerun eligibility. People can be asked for more proofs in order to keep their coverage, and it might mess with their CCO enrollment or their CCO enrollment timeline. And we don't want to do that. So any address changes, please don't do them in the AP, in the applicant portal. Please email Oregon.benefits or call your community partner line. I want to pause and see if there are any questions about that. That's a really important one, the addresses. That is the most common.
Yeah, feel free to type in the questions box if you have any questions.
Okay. Now, if you're going to report those changes, you can call the One Customer Service Center, you can send an email, and members can do that too. Members, of course, have their public telephone line, but the Oregon.benefits email is now for community partners and for members. So feel free to share that email with your clients because they can use it as well.
We do have a sort of a question, and I think it's a good one too, about applicant portal. Is that the one system? And the quick answer is yes. We'll often refer to the one system as the applicant portal. Sometimes you'll hear us talk about worker portal. It's simply a different door to the same system with a different level of access. We'll talk about integrated eligibility, and integrated eligibility is the same. All of that is done in the applicant portal or in the one system.
Thanks, John.
Yep. We use all those terms sort of very interchangeably.
We do. All right, now we're going to move on to the updated 6610 form. And this is an adjustment for me. This is technically now called the authorization for community partner help. Technically, legally speaking, it is not a consent form, and yet we're all used to calling it the consent form. So we know exactly what you're referring to if you say the consent form, and we may say it as well. But it does have a new name, and it has some new features as well. It does not have an expiration date. So now when you call 1 year and 1 day after somebody filled out an authorization form, you will not be told you can't help them. That's if they have filled out the new form, of course. But what I recommend is that everybody coming in should be filling out the new form, not the old form, and you might even replace some of those old forms, even if it hasn't been a year, if you feel like it. just to make sure they have a new consent on file or a new authorization on file. You're welcome to do that. It's not necessary, but it might make things easier about a renewal time if that year mark passes. It does have a fillable PDF option now, and it is longer, so you'll find that it has a front and a back page. And I do want to take any questions about the updated authorization consent form.
We had two things here. One was going back to the address, just to be clear. So if you're needing to update an address, this should be done by calling in rather than in the one system. Is this correct, Deanna, or is there any other nuance to that?
Correct. You can call in or you can email, but address changes should not be sent in through the one system. And I'll give you an example why. So depending on how an address change gets logged in the system or recorded in the system, it can put the CCO enrollment into a different timeline. If you report an address change through the one system, you have your client, like let's say they're moving from Multnomah County to Klamath Falls. And so they need to change their CCO, their coordinated care organization. If you put that address change into the one system, they will get enrolled in what's called the next monthly cycle. So a file goes over to the CCO to change CCOs once a month. That will leave them with a period of time while they're in Klamath Falls where they are still enrolled in Multnomah County CCO and won't have access to providers in Klamath Falls. However, the workers can input a non-eligibility change. They have more permissions and more functionality in the one system than you do as a community partner. They can report that address change as a non-eligibility update that goes through a different process, and the individual, the member, will be enrolled in their new CCO on what's called the next weekly cycle. So they will only have a few days, hopefully, of old enrollment before they get their new enrollment into their new area's provider network. I hope that makes sense and didn't just muddy the waters. It's different timelines, and it's better for the member to not do it in the one system. That's the long and short of it. So if you didn't understand what I said, that's okay. Just know that it won't hurt. Well, it's not wrong to do it through the applicant portal, and it won't mess anything up, but it could delay somebody's. Well, that's not really true either. It can kind of mess things up. It's not recommended right now.
So, and then we've got a couple questions here related to this. So there's an acknowledgement that the last two times that they've called in to update the phone calls, one, it seems like it's taking longer to do it that way and than it used to be in doing it in the one system. I'll acknowledge that, like the phone lines do get really busy and kind of clogged, and
I think that person,
time.
Yeah, I think that person might be saying something else, which is that the CCO enrollment timeline is different. I'm not sure. I'd like to know how to listen to that comment. If it's about phone wait times or if it's about CCO enrollment timelines. Maybe that person can type into the questions box and give us a little more information.
And then, are you seeing the questions, Deanna, or do you want me to read them out for you?
Can you read them out? That would be helpful.
Yeah, sure. So here's another question. It says, so if their address is changing within the same county and their CCO will not change, is it okay to do it in the one? Oh, that's the one you were referring to, wasn't it?
That's right. No, you don't want to do that.
I was referring to a different question earlier.
Well, no, that's a good question because they're not changing CCOs, but that address change will be logged as an eligibility change. If they're an immigrant, they might be re-asked for proof of immigration status, or outside of COVID, when we're asking for proof of income, it could ask them for proof of income again in order to keep their coverage. There are other ramifications of doing an eligibility update. So if you're reporting something that is not an eligibility update, like an address change, you should do it through the workers to keep the process clean.
All right, and here's another question. So if their benefits, Medicaid, has been suspended for incarceration and more than 30 days suspended, should I call the community partner line instead of going into the one system?
If somebody is releasing from incarceration and their benefits have been suspended, there are a couple different ways to handle that. If it is within 10 days of release, approximately, you can simply call the eligibility teams on the community partner line and ask them to reinstate benefits. Now I lost track of the question.
Yeah, basically, so if the benefit has been suspended for incarceration for more than 30 days, should I call the community partner line instead of going into the one system?
Yes. Your best bet and the quickest path for that individual is to call the eligibility line with the CP phone line and ask them to reinstate benefits if they were indeed suspended due to incarceration. You can add them as a new application in the one system. That's okay too. Either one of those will work.
We do have another question. It's about addresses changes, it looks like. It says, but when we call to do this changes, the OHP assister says they need a leader to get it done. How can we make sure they get it done?
So what I hear is that when you're calling with a non-eligibility update, like an address change, and you're asking a worker to take that action on the community partner line, they say they can't take that action they can't take it right away. They need to get a lead worker to help them with it. Is that what I hear?
Yeah.
Yeah. Sometimes if you are sending in an email, the many hundreds of eligibility staff don't all have access to that Oregon.benefits email. There's some technical challenges with that we're trying to overcome. And I do have hope we'll overcome them. But for now, when you send in an email, the eligibility worker you talk to on the phone cannot access that email, and they do need to get a lead worker to fetch that email for them. So if there's documentation backup, that might be the case. It's also possible you were working with somebody who was just in training, but my understanding is that if you call the community partner line, you talk to an eligibility worker, they should absolutely be able to make those non-eligibility updates for you without getting a lead worker, as long as the email box isn't involved. Does that explain your situation? Or is there something else that we need to know about? And if so, we should probably take it offline and you can send me an email and we can explore some more. Because one of the resources we will share with you at the end today, that John will share with you, is the the DHS worker coaching form.
Yep.
When we have, I don't know how many, John, 800? Who knows? It's all the DHS. It's probably more than 800. It's all the DHS storefront office staff from across the state and all the eligibility workers. It's hundreds and hundreds of folks who are getting trained on multiple systems. So everybody who used to just do OHP is now also doing SNAP and TANF and ERDC and refugee. Everybody else who was just doing SNAP and TANF before is also doing all the medical, MAGI and non-MAGI. That is a huge body of work for people to get trained on. And we need feedback from community partners to let us know if there's somebody who needs a little more coaching. So John will talk about that, but there's a teaser for it. That could have been what's going on.
I have one other here, and I don't know if we're able to answer it, but since the phone system is so hard to get through, what is the turnaround time supposed to be on an email update?
It's funny.
So if instead they email them.
I can totally answer that and not answer that. I can tell you why I can't answer that. But I think it might be helpful for you to know that the Oregon.benefits email box gets triaged. So some emails get answered before others. Anything that says urgent in the subject line, if it's medically urgent, will be addressed first. If there's some indicator that it's a pregnancy case that's not going to the pregnancy box, but that's going to that general box, that will also be a priority body of work. And I don't know the other priorities, and there may not be. Other than that, it may just be they get to them as soon as they can. And they are a bit backlogged, and I'd say that it fluctuates probably around 2 weeks, so it's not quick. You should not be using the email unless it's for urgent medical, in which case it will be addressed. The goal is same day, next day. If you say consent form only in the subject line, that will be addressed right away. Those are pulled out and worked separately because they're quick tasks. Other than that, it's first come, first serve for the most part, and I would expect at least 2 weeks. So call if it's more urgent than that.
So and then we just want a confirmation from someone. It says, I usually email versus call the community partner line. Is that okay for address changes, etc.?
I will say that you get to take what I just told you. I would assume at least 2 weeks response. If that is an okay timeline for that address change, then absolutely, especially if it's just within the same area, then I would say it's a perfectly fine way to report a change. If there is more urgency to that, such as they are moving to a different region, they're moving right now, and they need access to their new CCO provider network, then you probably don't want to wait those 2 weeks and you'd want to do something else.
Yep, well said.
All right, should we keep going?
Yep.
All righty. Give me a moment here while I figure out how to move my slide. Consent form. I think we get to take a look at it in a moment. Here's what we'd like you to do. We have these new consent forms. They're called Authorization for Community Partner Help. We would like you to recycle all blank copies and replace them. And what else? Remote signature guidance remains in effect during the COVID emergency period. So that's important. You can still sign them remotely. Now, I know we provided links here, but I'm going to take you into the forms server and I'm going to show you how to look up forms, because this is one of the most important things that I think people often don't get from their main training, because there's so much to learn in the main training. This just goes in one ear and out the other, or in one eye and out the other oftentimes. So we're going to go.
Thank you for doing that too, because we did have a question about where to find documents, and specifically this form. So this is
here's
for you.
how it goes. In fact, what I would encourage you to do, if you can, is you can watch what I'm doing, or you can even open up your own browser window and I will tell you exactly what to do and you can do it yourself. So I open up a browser window. I personally like Firefox, but if you're using Edge or Chrome, whatever it is, that's fine. And into my search bar, not my URL bar, I just type in OHA space DHS space forms space server. So it's the OHA DHS forms server, form or forms. And when I search, it is always the first one that comes up. I know it's the right one because it says shared systems.dhs OHA. So because it is all these forms are for OHA and DHS, rather the forms for both agencies are housed in one system. That's why it's called shared services. So if I click on that, it should take you to a page that says DHS OHA publications and forms, find a publication or form. And if you scroll down, there's a bunch of search parameters, but I just go to the main search box, the first one, and I type in the form number. So the consent form, the authorization form, I warned you, is 6610. There it is. And if I scroll to the bottom, I can click search. And once I pull up the form, you will see that it's available in many languages. In fact, there are 3 pages of languages in which it is available. But because I do not speak Chuukese, but it's pretty cool that we have it in Chuukese now, and Farsi and Chinese and Burmese. If we go to page 2, you can see that we have it in Hmong, Korean. We even have it in Mam as an audio embedded form. We have it in Marshallese and Pompeian, lots of languages. But I'm going to go back to page 1. English is my preferred language. And I'm not going to pick up the one that is large print. I'm going to pick up the regular old consent form. And just a note here, you can't just double click this or you'll think that something's not working. You have to select the form and then go up to this click to view the highlighted document. It's a little clunky. Click to view the highlighted document. And here it is in both PDF and doc format. Now I'm going to recommend that you open the Word doc and I'll show you why. You can do this in any of the languages. So the reason to go to the form server is, number 1, you get the most updated form. You don't have to worry about whether you have it or not. It will give you the most updated form. Number 2 is you get it in all the languages that it's available. And number 3 is you often, sometimes at least, have a choice between PDF and Word. Now this consent form in Word if you scroll down, gives you a big box for the applicant's signature. So if you are doing remote assistance, you want to be able to type in remotely signed for, let's say I'm helping John, for John McDade by Deanna Simon, and then I would put my assister ID to be safe, if I can spell, okay? And then you can put in the date, which is 11/15/21. So that's what it looks like if you are remotely signing a consent form over the phone with somebody during the COVID emergency period. You want to use the Word version. Done. Any additions or any questions?
We do have a question about a name change I want to go to. And it is, let me pull it up here. See, can I send an email to have a client's first name changed? Somewhere along the way in the applicant portal, his name was entered one way and it is legally different. So it was Daniel and it's legally Danny.
Yes. That is the best way to do it. In fact, you cannot change somebody's name or date of birth or cancel their benefits in the one system. So you need to work through an eligibility worker, and emailing that is perfect. I would remind you to please use a secure email. In fact, let's figure out how to use a secure email. If you think to yourself, oh my gosh, I don't remember how to generate a secure email. You have this thing called the Getting Started Guide. The Getting Started Guide used to be just a few pages, and then if you had a need for other resources, we would send them to you upon request. But we have switched gears on that. We now put everything into the Getting Started Guide so that it's all together, all in one place for you. So I'd like you to pick up your Getting Started Guide. And I am pulling up the most recent version here. And I'd like you to find the how to generate a secure email, and tell me what page it's on. Look in your table of contents. And in the questions box, tell me what page you will find information on setting up a secure email.
Nice. People are already typing in their answer, but don't accept it. Maybe they didn't get it right. So double check everybody.
Okay. So now I'd like you to go to that page 3 and just take a look. Where is it? Is that here? Yep, here it is. It reminds you that you can only send secure emails to state email addresses, and it gives you the link to do this, and it gives you all the information you need. And it even gives you the DHS service desk. It's your IT help in case you have any problems with the secure server. So please do that whenever you're sending client information that could identify your clients. And then it will be sent securely. All right, and we're going to move on. COVID emergency period. We have stuff that we have gained permission for you to do during the COVID-19 emergency period to make it easier for you to assist your clients and your applicants. A couple things that I want to mention is that it's not just about assisting, it's about accessing services. So we want to make sure that everybody knows this second bullet. This is a big, well, the first bullet is that you can assist remotely. You can do the consent form, authorization form remotely. You can do the application remotely. So that's great. We have a guide to help you know how to do that. In fact, can everybody go to your Getting Started Guide, please, and find your remote, oops, that's not the right place, and find your remote assistance guide, because that is really important. So go to your table of contents and find your remote assistance guide. Let's find it here.
Page 5.
Is it page 5? Assisting with OHP remotely. Excellent. I'd like everybody to review this and make sure that you know all of the permissions that are available to you, and talk to your team, talk to your manager, and ask your ROC any questions you have. We're not going to go into detail on it, but if you want to take a look at it during this webinar and ask any questions, I'm happy to answer them. John, is that okay?
Yeah.
An okay way to handle it?
I think that's totally fine because I'm not always confident that folks are up to speed on it. And the second part, we'll be referencing it a fair amount. And so I think it's just helpful to be familiar with it.
I'll wait until then. Perfect. Now, second bullet here is important. All OHP benefit levels cover COVID-19 testing and treatment, even COWM. So COWM is that emergency only coverage for individuals who are immigrants who don't have enough immigration status to get full benefits. And typically, COWM only covers emergencies that threaten life or limb. But during the COVID-19 emergency period, COWM coverage also covers COVID-19 testing, regardless of what the testing outcome is. So even if somebody gets a negative test, that COVID test will have been covered. And it will cover treatment of COVID conditions. It will not cover treatment of other conditions that are being treated at the same time as COVID. It is limited to COVID conditions, but even COWM covers testing and treatment and vaccinations. Another provision during the COVID-19 emergency period is that benefits will not end for most members during the emergency period. There is there are a few exceptions. If somebody moves out of Oregon, their benefits will end. They pass away, their benefits will end. And if they are on Coverall Kids, because they're, let's say, an undocumented youth, they have Coverall Kids full OHP benefits, and they turn 19, that puts them into the adult benefits category, and their benefits will drop to COWM. They will not stay full OHP. So that's one of the few categories of people who will not maintain full OHP benefits during the COVID emergency period. But for most members, benefits will not end, and that includes COWM Plus. So COWM Plus is for anybody who is an immigrant and only on COWM, that emergency only coverage, but then is pregnant. COWM Plus is full OHP benefits, full OHP pregnancy benefits during the pregnancy and after the pregnancy for at least 2 months for all pregnant individuals, regardless of immigration status. And that coverage will also stay and not be reduced or end after the pregnancy. So I just wanted to point out some of the things that it applies to that really can make a difference. There's also a lot of telehealth options and a webinar that covers what CPs need to know during the COVID-19 emergency period that John will go over. He will show you where to find that webinar in the group site tour, looking at our training resources later on. John, are there any questions?
Let me look, not that I see. All right, hold on. Does COWM cover transportation?
I'm pausing.
That's okay.
I should know this. I
don't think
believe that it
is.
should. Well,
Right?
but if it's to COVID covered services, I believe that it will cover non-emergency transportation to COVID covered services. And I will verify that while you're giving the second half of this training. I will
Great.
send an IM or two and confirm that. But I'm pretty sure it does, but hang tight for confirmation.
Okay. And then another question, I'm not sure I understand the question. Couldn't find the questions thing. The secure email is on page 1. Does that make sense to you, Deanna?
No. What we were asking people to do was look for the secure email. Is it page 1 of the Getting Started guide? It might have been. Anyway, as long as you can find it in your Getting Started guide, you're good.
Yeah.
All right. And if you're typing into the questions box, then you could find the questions. You're there. So that's what we were referring to. There's nothing else. You have found it.
Yeah.
Right. Well, in that case, what I'd like to do is move on to rights and responsibilities and notice of privacy practices. My favorite. All right.
You are the resident expert on this, and so I think our participants are lucky to have you talking us through this part.
Yeah, thank you. Yeah, I've put a lot of effort over the past year to understand what our agency needs our community partners to do and why, and how to make that happen, and how to make it happen in a way that produces as few barriers as possible. And I want to acknowledge that there are still barriers. So I'm curious, can you type into the questions box, everybody? do you already know when I say you need to provide rights and responsibilities and notice of privacy practices? Do you know what I'm talking about, or not so much? I want to know how many people are on board with this, and even maybe I should ask a different question. Are you doing this, or are you not doing this? And I'm not doing it to call you out on anything. This is new guidance that we're providing. And some of you may be hearing it for the first time during this recertification training. So if you're not doing it, it's perfectly okay. I just want a barometer. How many people are doing the rights and responsibilities for applicants, and how many are not? Okay.
So Deanna, we have a couple things coming in. The first one is folks are asking if you could make your screen in presenter style so they can see the full screen.
Of course.
Thank you. And then it looks like we are seeing kind of a mix that some do, some do not.
Yeah, but more do than don't. So that is terrific. Okay. All right. This is your opportunity, if you're already doing this, to ask any questions or give us some feedback about how it's going. In fact, if you're already doing this, please let us know how it's going and how we can continue to support you. Okay. If you're not doing this, then listen in.
And I'm seeing some wonderful things here. Like we've got a person here they've learned about it. They're going to be training their entire sister staff on it to make sure that they're doing right. That's a great practice. Thank you. And yeah, nice job, you guys.
Okay. Let's start with what they are. The rights and responsibilities are a set of pages, and it's a big document that outlines what the agency will do for the applicant and what the applicant agrees to when they apply for coverage and sign their application. This gets paired up with the Notice of Privacy Practices, which is a separate document that outlines how we use an applicant's data. Now, they're important because when an applicant signs the application, they are actually agreeing to having received and understood these two documents. I understand and agree to the rights and responsibilities, it says, right before they sign and have the declaration and signature page. I don't want anybody else deciding for me what information I should have before I sign my name to a legal document. That would be inappropriate. And so I get why we need to provide these, right? Applicants have a right to know what they are agreeing to before they agree to it, before they sign. And so you as community partners must provide these documents before somebody signs the application. And in fact, when somebody goes to an ODHS office, they get these documents. Even when somebody calls on the phone lines, they get these documents in some way, shape, or form before they sign the application, even if they're just signing verbally. So you as community partners must do the same thing, and we intend to give you the resources to make that happen. I'm going to skip this page because I think we say it better in other slides.
We have a quick question.
Mm-hmm.
I've been reading through this, but not having the client sign. Is this form available on group site?
I'm going to show you where these forms are available, so hang tight, okay?
Awesome.
Now, here is what certified assister organizations must do. You must provide these two documents to every applicant, the primary applicant, so the person who's signing, before they sign. The rights and responsibilities can be found various places, but the best place to find it is in the OHP application guide. It's on pages 11 through 16. It's actually not in the paper application. It is contained in full in the applicant portal, but because depending on where you apply, you either get the full document or you don't. The easiest thing that we thought to tell you is provide it to everybody, pages 11 through 16 of the OHP application guide. Now, since you're already familiar with the forms server, you know to go to the forms server and search for form 9025 to find it in any of the languages that you are serving folks in. Yay. The Notice of Privacy Practices, again, is available in different places. but we thought it would be easiest just to point you to the form so that you always have it in one place. It's actually form 2090. If you type in A, it messes you up. So form 2090 on the forms server. Those are the two best, easiest places to get these forms. So hopefully that answers the question that the individual was asking in the questions box, John.
Thank you.
Okay. The other things you must do as a community partner and an organization is you must ensure the applicant, I'm going to change the wording on this a little bit, knows what information was put into the application for them and therefore will be submitted. The reason is that when you're in person and somebody is watching you fill out a paper application or watching your applicant portal screen, that happens naturally. But over the phone, when they don't have a visual, it's a little bit more complex. So we need to call it out. And you can do that in various ways, which I'll go over in a moment. The other thing you need to do is provide a copy of the submitted application if requested. So you need to have a way to do that. And we'll show you how to do that as well. And finally, your organization must document the process for how assisters at your organization provide these documents and this information. And you must document the process for reporting changes on behalf of members. Now, the good news is this is a lot, but we give you a guide and we outline every step of this and give you all the resources that you need. So I'm going to walk you through the guide in just a moment. Before we do that, I want to say that you can share these documents in a variety of ways. You can have somebody view them on a screen if they're physically with you. If they're not with you, you can send them a PDF or a link and they can view it on their own screen. If you're doing in-person assistance, you can show it to them on a piece of paper or even a laminated piece of paper. They don't have to have a piece of paper to take away. They can look at it. Or you can give them papers beforehand to view before the application appointment. You could send them these documents in the mail. You could actually call your local ODHS office and ask them to send these documents. Like there are a lot of options. There's even more options than this in the guide. And you can share them electronically however you want to share them. In addition to sharing these documents, you need to make sure that the applicant knows what information is put into that application for them so that they can make any changes before it gets submitted. In person, you can have them follow along on your screen or on the paper application. You can have them look at the final summary pages in the applicant portal. If you're assisting remotely, you can repeat back the answers as they say them. So let's say somebody says, well, I make $1,000 a month from my job and it's pretty consistent. Then you can say, all right, so your monthly income that I'm putting in here is $1,000 per month ongoing. So as long as you make sure that you heard them correctly. In terms of providing a copy of the completed application, you can do that in a bunch of ways. If you're in person, you can print it out for them. But if you are working through the applicant portal, you can go, I wonder if I have a screenshot here. I do not have a screenshot. If you go into the person's account or case in the applicant portal, at the top, you will have a tab that is called My Actions. And in that My Actions tab, you can print a copy of their application. And that's how you would print it out for them if you were in person. You can also print it to PDF from there and send them that file if they have email. And finally, you need to document your process for doing this. And I'll point out something else here. You need to document your process for providing these documents. You need to document your organization's process for making sure that each applicant knows what information gets entered for them. And you need to document your process for how you report changes. I do want to take a moment to talk about reporting changes. It's not on this slide, but I want to give you some background. So reporting changes is a member's responsibility. They signed that responsibility at the end of the application. And if they report it to you, that does not finish their responsibility. They need to make sure that it gets to the agency. So what was happening is there were applicants who were having conversations with the agency, and they were saying, well, I reported my change. I gave my change to a community partner, but the agency didn't see that change logged in the system. So it made us realize that community partners need to know that you have a responsibility, that if somebody reports a change to you, you must submit that change right away to the agency on their behalf. And if you can't, you must let them know that you can't do that and let them know other ways to report that change. So that's the piece that I wanted to call out because it was creating problems at the agency, a little bit of he said, she said. Now that's the quick overview of rights and responsibilities, but the good news is we have some in-depth resources for you. So the first one is we have a guide called Providing the Rights and Responsibilities and Notice of Privacy Practices. We also have a recording webinar that's 1 hour long. It's actually a little bit more than an hour that goes into all of these details. So I want to take you to the guide first. So if you can please go to your Getting Started guide. Guide for Rights and Responsibilities and Notice of Privacy Practices, page 8. If everybody can please go to page 8. This is your guide. It outlines what community partners have to do, how to share the documents, some details about if you're assisting in the applicant portal and other places to find these documents. It gives you some suggested talking points for providing them, in case that's helpful. It also talks about the requirement to review the application information with the applicant before submitting, and it shows you where to find the My Actions tab in the applicant portal to print a copy of the application if it's requested. And then we have some suggested talking points for that requirement as well. And on page 3, we talk about documenting your organization's procedures, and we also give you sample documentation language in case it's helpful. So each organization will do this differently, and you'll have to do it differently depending on who's applying with you and what their needs are. So if you have any questions about this, I encourage you to read the guide, to watch the webinar that John will show you in a little bit, and to reach out to your ROC to troubleshoot it. So it's a new requirement. Well, it's actually not a new requirement. It's new guidance that we're providing now that we know community partners need to be doing this. So we want to hear from you who are already doing it, what some of your best practices are and what some of your feedback is. Some of that feedback, John, I'd just like to keep internal because I don't want to take up people's time. But if there are any best practices that people would like to share that are useful to newer community partners who aren't doing this yet, I'd like to share that stuff. So I'm not sure if John is still with us.
Oh, sorry, I am here. Didn't realize I am muted, talking and muted.
That's good. I'd say that I'm going to address a few things that are in the questions box. Somebody says, I wish we had a recording of it. We do too. And the good news is we have gotten permission to get recordings. We are currently in discussion about how to provide them to you in a file size that will not be a barrier. So we are working on that. I will let you know that the recording is going to be more than 20 minutes long. So your best bet is probably to try to get, if possible, these documents, either audio version or written version, to clients and applicants before the application appointment. And then when you're helping them apply, you can just say, have you reviewed the rights and responsibilities? And are you ready to sign to them? But let's see what other ideas or comments people have. Good, somebody is taking a training with their whole team. We are giving out the rights and responsibilities and the notice of privacy practices, and we have a training coming up that we are giving our team on it. Perfect, I love that. I think that is probably what's needed. I've been reading through it, but not having the client sign. So they don't need to actually sign the rights and responsibilities as a separate document. When they sign the application, they are signing to them. So you don't need to have a separate signature. You just need the consent form signature and the application signature. And you need to have shared and provided these two documents. So hopefully that's a useful clarification. If there are any practices used in the jails, please share. Is anybody assisting individuals in an incarceration environment, and do you have any guidance for that? I would say that when somebody signs the consent form, you could also give them a laminated copy of the rights and responsibilities and notice of privacy practices and let them know they'll be signing to that. That's one way to do it. That may not meet with your needs, I don't know. Are there any ideas for how to help somebody in an incarceration setting? Here's something. I have always kept a spreadsheet of applications I assist with. And on that spreadsheet, there is a notes field where I document different relevant things about the interaction to refer back to in case I need to follow up. I've now added rights and responsibilities and notice of privacy practices to that to make sure I give it to the client. Excellent.
Nice.
I like that. That's the kind of thing that could be in your documentation. Our assisters keep a spreadsheet. We document when it's been done. All right. I'm happy to answer any questions about that or move on. Okay. In fact, what I think we should do, John, can we do a group site tour after a break?
Yeah, absolutely. You're reading my mind.
All righty. It's 10:20 on this, at least where I am, sunny November 15th, Monday morning. Thank you, John, for grabbing the slides.
You betcha.
And I will be here on the questions box.
All right, fantastic. Thank you, because I don't have the questions box open, so I can't see it, and I appreciate you hollering out as those things come up.
Yep, I'll just tap on your foot really hard if we have a question that needs to be answered, okay?
That sounds good. I'll yell, ouch. All right, welcome back, everyone. Hope that quick 10-minute break was the refresher that you needed. Stretch right now and get ready for as we buckle in for our last 40 minutes of this training. So let's talk a little bit about group site. Can you confirm for me, Deanna, which screen they're seeing? Are they seeing my group site tour, or are they seeing the actual group site?
Actual group site.
The actual group site. Okay, great. Thank you. All right, so if you're looking at your, what I've done is I'd like to give you a quick group site tour. And we have recently made some major updates to group site that at first glance you may not have noticed, but I want to make sure that we point out. All of you should have an invitation and create an account for group site. If you do not have an account for group site and would like one, please put in the chat box, I would like an invitation to group site and your email address so that we can do that, okay?
In fact, if you haven't used group site in 6 months or you're just not sure how to get there, we can just resend you an invitation. And I encourage you to do that because we do delete people who haven't used it in 6 months to keep our membership within our limits. So better to ask for an invitation if you're not sure.
Yep, absolutely. And group site is really awesome, especially it's like I have to think about it as your #1 go-to resource. Look, if I'm working in an organization where I've got coworkers who are doing application assistance, I probably go to them first. If they're sitting by, and I can quickly ask them the question. But if not, I'm probably going to group site to seek my answer. So what you can see currently on your screen is the homepage or the landing screen. And you'll see up at the top is, our generic welcome, telling you a little bit about what group site is. And then I'm going to point out something that's brand new, and it's called our featured topic. The featured topic may or may not be there depending on the day. What we've tried to do is that if there's something urgent and we want folks to know about it essentially right away, and we may or may not send out a large email to everybody, is this featured topic, and it's about whatever we think is the most pressing issue that we want to make sure everybody knows about. And so currently our featured topic came from back on October 28th when password updated for all of our applicant portal users. So all of you, probably have done that by now. If you've not logged into the applicant portal at this point, you will, the next time you log in, have to update your password. And this featured topic gives you sort of the details on that. I would anticipate in a week or two, this featured topic, specific topic will be gone, and whatever the most updated and important information that we want to get to right away is there. So know if there's something going on you want to know, go right into group site, and right at the top we'll have a featured topic if there's something that's burning and we want to make sure that folks know about it. You'll see that up here we also have important required trainings and questions to that. We have upcoming events. We have some recent announcements and the latest updates to File Cabinet. So you may or may not use a lot of the stuff that's on this landing page in terms of as you scroll down. For me, I think most folks are probably going to go into a couple of areas, and you're going to be able to find those over here on the left side on your dashboard. I'll start with what I think is sometimes the easiest is, since we're in training season, and do you need to take a training? Which training do you need to take? How do you register for it? And we've tried to make it prominent, so we've added it to our left side here under trainings. And when you click on trainings, now I don't always love the way this shows on our screen. Part of it is due to the limitations of GroupSite itself, but we tried to make it as intuitive as possible. So under the training section, once you are in here, we've tried to create tabs across the top here based upon the specific training. So if you wanted to register for one of our modules, you could click on that, and that'll give you the registrations for the modules. The recertification training, which you're all in today, I'll click on that. It gives you the registration for community partner trainings for this year, and you can register in either English or in Spanish. So you have those options. And when you click on these, it'll give you the options for all of the trainings, recertification trainings, and the dates in which those are happening, whether it's in English or Spanish. The certified assister training, you're going to see more resources in here because there's a pre-training module that folks have to watch. Also along with account setup. So you'll see there's more resources and of course registration for it, whether you're doing it in English or in Spanish. So anyway, though, that is the place you're going to find the trainings that are required, the ones that are optional, the registrations for those, and sometimes some of the materials necessary for those. The next place I'm going to go is into our file cabinet. We've made a major revamp to the file cabinet this year and sort of launched it in recent months. Again, we've tried to make it as intuitive as possible, but even with that, I think there are challenges. At the end of the day, we've created a lot of different files that are resources for you, the assister. And we've tried to put them into sort of categories that make the most sense. Today is a great example. We're doing a training today, but we have, we keep referring back to the getting started guide. So since it's a guide, I can go into the forms and guides section. And in here, you'll see handouts that happen during trainings. And you can see some of the guides for whether pregnancy and newborns, etc. So in here, I'm going to go to handouts during trainings, and I think there's the getting started guide. So if I want the getting started guide, I can simply click on it, and it will open up for me the getting started guide. I'm going to jump out of that right now, but in essence, the file cabinet is the place where you should be able to find most of your resources for whatever it is that your work that you're doing. I'm going to point out the discussions section. If you have a question and you'd like to go essentially to the community of assisters and ask a question, you can do that in the discussion section. And you'll see in here, we've broken it down into a number of different areas. We have announcements, and those are announcements from us here at the Oregon Health Authority. It might be that we know that the system is down for an hour or two, and we'll put that in our announcements section. If you have sort of questions you want to ask, that's a great place for it in general discussions. One system and processing if there's issues that are happening there. We post job openings in here and resource for COVID-19 etc. So you can sort of see that we have a number of different topic areas and a great place to go if you have a question, or perhaps somebody has already asked the question and you can already find the answer for it there. Our team does monitor the section so that we know that whatever answer gets posted, that it is vetted through our staff as well to ensure that you're getting really good accuracy. And I think the final thing I'll point out right now is the calendar section. And the calendar section is, if you're wondering, let's say, about when your next collaborative is within your community, you can find it in the calendar section. And I want to point out that there's a couple different ways in which you can view your calendar. This way right now, where it's sort of a list of items, I prefer to see it change my view style and change it to a calendar instead. So I click on that little button over there and look at calendar. And here I can see all of the different things that are put into the calendar. So whether it's one of our trainings like we're doing today, whether it's a local collaborative, or maybe an event in the community that we've posted here to let folks know about, is where you're going to find it. And when you click on any of these, it will then, of course, give you the level of detail that you need and the registration links if it's something that you would need to register for. So know that that's where you can find that.
John, I have two. Oh, sorry.
No, go. I was just turning to you to ask, are there any questions?
A couple things. Number one, there aren't really any questions, but I was multitasking, so I wasn't listening. Did you already give a plug for regional collaboratives, especially for new assisters?
I very briefly, but let's go into a deeper dive for that. Thank you. So, especially for newer assisters, but for all of you, like if you can attend a collaborative, we would love to have you, whether it's a virtual collaborative or an in-person collaborative. I think all of ours right now are all virtual collaboratives, which for many might make it easier. But what is a collaborative? A collaborative is a monthly meeting that happens for your specific region, typically for your county, is how they are done. And they're facilitated by our staff. And we try to bring you the most up-to-date information as it's related to OHP. And we never run out of topics. Every single month there's something new that, to bring folks up to, something we'd learn that we want to make sure that you're aware of. But it also provides an opportunity to collaborate with those in your community who are doing application assistance. Maybe there's something you've learned that's really helpful that you're doing when you're providing application assistance and you want to share that. Maybe you're having a number of folks who are coming in recently who have been recently released from incarceration, and you want to make sure that they're connected with an assister who works with folks who have recently left incarceration. So it's a chance to know who are the other folks in your community who are doing application assistance and the communities that they're working with, so that when it comes time and appropriate for you to make referrals, you actually know some warm handoffs that you can make, or a person you can call and ask those questions to. So it's really valuable from that point as well. If we would love to have every single organization represented at your local collaborative, but sometimes organizations can't send, all 20 or all 5 or all 4 of their assisters at the same time to a collaborative. So if you're not able to go, but someone from your organization goes, please have them share as much information with you about the collaborative as possible, but know that you can also go in to the files section in the group site, and you can go into the, where's my collaborative section? Region specific resources.
I'm seeing CPOP collaborative meetings.
There we are. Yeah, thank you. My eyeball was going, where is it?
You're looking for collaborative, not CPOP, yeah.
Yeah. So anyway, there we go. So you can even go back to past collaboratives. I'm going to click on the 2021 collaboratives, and you'll see that we have a file folder in here for each month, and it contains our PowerPoint that we delivered for the collaborative and any handouts that we used as well. So know that if you're not able to attend or you don't have somebody who's reporting back, you can always go into the file cabinet and look these up. And to be honest, I would highly recommend it, because this is sort of some of the things that we've been talking about already, like the rights and responsibility for them, and at collaboratives, as soon as we were having information and updates about it, that was one of the places we were sharing some of that information. And it's nice to be able to ask questions directly of your rocks and the impacts. So it's just a great place to go.
Right. The other thing I wanted to say, John, is that if anybody is looking at this and realizes they haven't been there for 6 months or more, or you're not sure how to get there, or you just don't have access, send me your email inside the questions box. And there is one person, Flavia, if you can send me your email so I can send you that invitation, that would be great. And anybody else who now realizes they need an invitation, let me know and I'll send it over.
Fantastic. All right, can you see my slides, Deanna?
Yep, I can.
All right, awesome. All right, I'm going to go ahead and move us on at this point. Some of these things I've mentioned, but I'm going to just highlight them again. So there are a number of learning opportunities that we provide throughout the year, and in fact, every single month, that are not required trainings, but we'd love to have you attend them if they're relevant or would be helpful for you. So obviously we have things like our Certified Assister training, the Recertification training, but we also have monthly modules on specific topics. We have a webinar series specifically on integrated eligibility. So as we talk about the new one system, and there are always changes that are occurring there, and just a lot of nuance about how you add information there and how it might be used depending on the program that the person is applying for. Regional collaboratives are always available, as I mentioned earlier, and we do those statewide collaborative meetings in Spanish as well. So if you or one of your other certified assisters within your organization would prefer to attend a collaborative in Spanish, you can attend a statewide collaborative in Spanish as well. We have a justice involved collaborative. So if you are working specifically with the justice involved community through jails or prisons, there's a collaborative for you as well. And we have a COVID-19 webinar series to boot. I just want to mention this quickly because I'm going to assume most of you know this. At the end of the day, when somebody is brand new as an assister, they must take the Certified Assister training. It's a full day training. It's part of their onboarding process. It typically lasts from 9 a.m. to 4 p.m. In the afternoon. You need to take it once, essentially when you're first coming on. That doesn't mean if you want to take it a second time, you couldn't. So any of you who are currently in this recertification training, you obviously took the Certified Assister training at some point. If you felt like you wanted that full day training again, just as a refresher, you're more than welcome to attend, but only those required are those who are brand new, who are in the process of becoming certified. The recertification training, which you're all taking today, which is basically required by anybody who has gone through the full training and completed that in their first year. And now you simply need to take the OHA recertification training. And now there is a training that you'll also need to take through the marketplace. So there's essentially 2 annual required trainings, and one of them is the recertification training that you're in now that is done by OHA. So there's an OHA side and a marketplace side as well.
Sean, could we take a pause there? There's been is that okay?
Yeah.
And maybe we should actually, after this marketplace training slide that you're about to go over, let's ask people what they've taken, if they know, and if they are still confused, so that we kind of can get a read on where people are at, because there's been a lot of confusion about this.
Yep, I think that sounds great. Yeah, so if you have questions about any of these trainings, which ones you've taken, do you know if you've taken them, put that into our questions box. And I'll go ahead and in this process talk about the marketplace annual training. If you've taken both already, tell us that you've taken both, the recertification and the annual marketplace, or which ones you have left to take. And if you're not sure, add that as well. So the marketplace has annual trainings as well. There's the marketplace assister training, there's the overview training, and the refresher training. So let's talk about these. So the marketplace assister training, it's required by at least one assister in your organization at each location where your organization offers application assistance. So let's say you're a clinic or a hospital, and so there's multiple sites with assisters at each of those sites. You must have at least one person from each of those sites attend the Marketplace Assister training. This one is a much more deeper dive into the Marketplace eligibility in the application system, and it includes online modules, a live training, and an exam. The reason we want to make sure that at least one person at each site gets this deeper dive training is because we're trying to create a no wrong door for anybody in terms of where they show up for assistance. So if they show up, they want to apply for OHP, but they are indeed eligible for Marketplace because they're ineligible for OHP, we want to make sure that we have an expert at each site who can go ahead and assist them with the Marketplace application process as well. And if not, we want to make sure too that they're doing the appropriate referrals and where to refer them to for an agent perhaps to get assistance as well. But we do want to make sure that we've got someone who's got a deeper level of understanding and have that Marketplace Assister training. There's a Marketplace overview training, and this is required of anyone who provides OHP application assistance who does not take the above mentioned assister training. The overview of the Marketplace covers Marketplace eligibility, and we'll talk about referrals. So you're going to get a good training with this overview training, but you may not get quite as in-depth about assisting with those who are eligible for private Marketplace plans. And then, of course, there's the Marketplace refresher training. It's available by invite to assisters who have fully completed the highest level of Marketplace training and exams in each of the previous 2 years. So condensed in a fast-paced version of the full assister training. So essentially, once you've been doing the work for 2 years, you've taken the required, whether it was the assister training or the overview training, you then become eligible to take this refresher training. You'll know if you're eligible because you'll get an invitation for it. If you have questions, I do want to make sure that you go to the DCBS page that's listed on the screen there, or email cp.marketplace@oregon.gov. That is going to be a great place. In fact, I would highly recommend, maybe the quickest way, if you have specific questions, is to email the cp.marketplace team for questions. Any questions come up, Deanna?
I'm just responding to some people privately about Marketplace trainings and clearing up some confusions.
Okay, cool. Thank you.
But here's a question that I think will benefit everybody. We're an organization that has multiple programs but work at different site locations, Hillsborough, Tigard, Beaverton. So in that case, even though you're one organization, each location needs to have one assister who can help with Marketplace applications. And in order to help with Marketplace applications, you need to do the full Marketplace Assister training. Everybody else who's not that one main person can either choose to take the full training and help with Marketplace applications, or can choose just to take the overview so they can make powerful and really effective referrals. So, but that is based on individual location, not organization as a whole. And something else that I want to put a little plug in for is that I really, John, if you already said this, I apologize. I was multitasking with answering questions. But I encourage everybody to take the full Marketplace training if you can, even if you're not going to assist with Marketplace plans. And that's for 2 reasons. The first one is probably pretty obvious. It's just so you can understand the universe of health coverage options better and know what's available to people and really speak about the full range of what they have access to. But the second one, and please listen up, is that I think it's a hit. There are great Marketplace plans for very low cost, just a few dollars a month with very low deductibles. So, something like $8 a month with a $200 deductible and a $5 copay. Those plans are available to immigrants who have any lawful status, but only get COWM. So if you're working with immigrants who have any lawful presence, so they can't be undocumented or DACA, but anything else, and they're getting COWM only, maybe somebody who's here on a work permit, they get COWM, they can also get maximum financial assistance on Marketplace plans. So this is not just for individuals who are over income for OHP. It's for immigrants who get CALM and have any lawful presence, can get amazing plans on the marketplace. So please consider, if you didn't already know that and you don't know how to talk about it and you're helping that population, consider taking the full marketplace training so you really know what's available to those folks.
Yeah, well said. I think there's a lot of value in having the deep knowledge about the marketplace plans. I think it just makes you better assister because inevitably you will have folks who are not eligible, or you'll have a household where some members of the household are eligible but others are not, and having the knowledge to understand how the marketplace works, even if you're doing a warm handoff to somebody, it's just nice to be able to tell them about what they can expect. All right. Next, we have our monthly modules. So our monthly modules are held on the first Tuesday of every month. They last basically about 30 minutes. We keep these short, sweet, to the point. They're sort of micro trainings, and you can find these monthly modules in group site under trainings. So we record all of our monthly modules. If you're not able to attend, know that you can listen to and get the PowerPoint presentation because it is recorded, and you can find that in group site under our training section. If you'd like to register for a monthly module, the monthly modules are always done one in English and at least one in Spanish. So whatever your preference is, you can go and register for those modules. And the nice thing, I think, once you register for the modules, it registers you once for all of them. So you don't have to keep going back and registering over and over. It registers you for the entire series. And if you're able to attend one, some, or all, you're registered through that one registration. All right, so there's the integrated eligibility webinars. So these are live webinars. They're held on the fourth Wednesday of the month from 9 to 10:15. And currently they're just in English. We may have them in Spanish eventually, but currently just in English. And then held on the second Wednesday of the month from 9 a.m. to 10 a.m. In Spanish, sorry, until further notice. And recordings are available for both of these types of training. So we really want to make sure that if you're not able to attend, that we make a recording available for you. And that recording includes the slides with the voiceover on that as well. So, and these integrated eligibility webinars are really good and valuable. I feel like they're super timely and really helpful. And the regional collaboratives, which I mentioned earlier, you can see based upon how we have colored through on this map, some counties are combined with other counties to form a regional collaborative, but know that these are happening every single month. If you currently do not attend one of these and would like to, go to group site, to the calendar section, and in the calendar section you can find your region's collaborative when it's occurring and register for that collaborative. And I think right now most of them are being done virtually, so they're most of them are done via Zoom, I think specifically. All right, guides and resources. So there's we have provided in the, and I haven't checked this out, but in our handouts for today. So all of you, if you look on the right side of your screen, you're going to see as part of your dashboard, a section that's called handouts. And currently there are 4 handouts that I'm going to be referencing as we move forward. Some of them you may have already opened, maybe you've already saved. I would encourage all of you to download and save these. Someone was asking earlier about where you get the Getting Started guide, and we've actually included it as part of our handouts here today. So you should be able to see that on your right side of your screen. And so let me now go to a quick look at Medicare and the Medicare guide. Here's what I suspect for many of our sisters is that as you now are able to help people in the one system for those who might be 65 and older, you may get folks who have more Medicare questions. And so having this Medicare guide on hand, I think is really helpful. I certainly know enough information to be dangerous, and that's why I feel like it's really important for me to have at my fingertips things like this Medicare guide that answer a lot of those questions and can be really helpful for the person that you're helping sign up for medical coverage. So, and in the Medicare guide, it's going to cover what is Medicare, what are the parts of Medicare and what do they cover. They'll talk about the different Medicare options and getting the help for Medicaid members need, which is really about SHIBA and making sure that folks get connected with SHIBA. Deanna, did you want to add anything else about the getting started, not the getting started guide, sorry, the Medicare guide, other than that's pointing people to it?
What I do want to add something about it, which is not the Medicare guide, but it's the fact that with the one system now, people who are on Medicare can apply for financial assistance paying for their Medicare out-of-pocket costs. So if somebody's on Medicare, don't assume they shouldn't apply for anything. They absolutely should. They might get help paying for Medicare, and they might be eligible for non-Magi medical assistance and get both Medicare and Medicaid. So it's very
well said. Yeah, thank you, Deanna. That's just such an important point about let's submit applications for folks in the one system, because if they might be eligible for additional benefits other than Medicare, let's make sure that we see if they are and screen through that process. All right, there's the Getting Started guide, which we've referenced a couple times already. Please go ahead and download it. You can see it there on the right side of your screen where you have your dashboard. All of you should have this, and keep it handy because it has so much information in it that's super helpful that really I think you probably will use with some regularity. There's also the Column and Column Plus guide that we've posted there for you. I want to point out something. I don't know if we've talked about this earlier, and my apologies, Deanna, if you had mentioned this.
No, we did not. Please do.
Thank you. So Column, which we have historically referred to as CAWM, which stood for Citizen Alien Waived Emergent Medical. We are no longer using that term. You will still see it like in the document itself as the CAWM, but you also might see CWM. CWM is the new way in which we're going to be referring to Column, and you will see the old version of CAWEM disappearing. It's in the process of a rules update and changing of the name. But Citizenship Waived Medical is what it is. In essence, we want to make sure that folks often think they are not eligible, and often because of maybe an immigration status. In Oregon, regardless of immigration status, you may still be eligible for some level of medical benefit under OHP. And that sort of lowest level is what we call CAWM, which is essentially emergency room eligibility. So let's make sure that we are submitting applications for folks to see if they are eligible, perhaps they don't have a legal status to be in the country as an adult, or they do have a legal status to be in the country as an adult, but they've held that status for less than 5 years. So if they're a lawful permanent resident, but have held that status for less than 5 years, if they meet the income criteria, they may be eligible for CAWM benefits as well. The same is true if you are a pregnant person, an adult without a documentation status, or have held that documentation status for less than 5 years, you may be eligible for full OHP benefits, which we call Column Plus pregnancy benefits, and that those benefits are eligible for those pregnant individuals who may not have a documentation status, and they'll have full OHP benefits for up to 2 months after the end of pregnancy. That's the typical rule, but right now, during the COVID emergency period, we will maintain full OHP benefits for Column Plus members until the emergency period is over. I will also add that historically when we talk about Column, we talk about that they are only covering life and limb. So oftentimes when somebody goes to the emergency room and they only have column level coverage, they are experiencing an emergency. But once they get there, the emergency room doctor determines this is not a life or limb emergency, and they get stuck with a bill for whatever care that they needed. So let me go into a little bit of detail about things that have changed or are in the process of changing. First of all, if we're talking about COVID-19 and they only have column level coverage, they can go to the emergency room, they can get tested, and if they test even, which is free, whether positive or negative, can get tested as many times as necessary. If there is if they do test positive and need treatment, their column level coverage will cover that treatment. For moving forward, there will be higher benefit level coverage for column members, greater than what we have seen historically. I'm not ready today to talk about what that looks like, but know that there may be more level of coverage than what has historically been covered. It's still not going to be full coverage, but there may be more coverage, and keep your eyes peeled as we probably will provide a training on that in the future
In
as we have
fact,
more detail.
somebody had asked in the chat box, are there any changes upcoming to that? And that is John's answer to your question.
Yeah. Yeah, there's a lot of good news as it's related to column and level of coverage, I think, moving forward. So still not perfect, but it's moving in the right direction. All right, the application guide, or what we call as Form 9025. So the application guide is basically, for anybody, whether it's an assister or somebody who's applying, it is the guide to the application to apply for OHP. So if you get to a question in the application, you're not sure why or what they're asking for, the application guide can be really, really helpful with answering those questions. It does not hurt to have application guides on hand, does not hurt to hand those out to those that are applying, even though you may be assisting, and it certainly can be helpful to you if you're unsure about certain questions, how to use that sort of thing, to refer to the application guide. And you can always find the application guide as well by going to our forms server, which Deanna mentioned earlier, and type in 9025 into the search, and you will get the application guide, and you'll get it in your preferred language, more than likely, because we do have it available in multiple languages. It's also nice, just like how long before I know what I qualify for. It's the sort of thing like if there's a waiting period in terms of a process piece that they're not sure, it's just nice for your applicant to be able to refer back to it if they're interested, to know about the process as well and what to expect, who to call if they have questions, those sorts of things. All right, the OHP application assister safety screening. So we have screening applications for safety concerns. And so why does the Oregon Department of Human Services want to know about an applicant's safety? And what should I look for on the application? What should you do when someone indicates safety concerns? It's a safe time to talk, and how do I address these concerns with the applicant? Trauma-informed best practices and other resources. So to make a long story short here now, let me look here. Okay, so why do we ask these questions? We want to make sure that folks who may be in a domestic violence type of situation have the resources to help them to address domestic violence. So it's one of the reasons that we're going to ask the safety question. If somebody indicates that they have safety concerns, if you're doing an application over the phone, you might ask them, is this a safe time to talk? Are you able to give me the answers that you desire or not? So, is there a better time to call back if necessary to be able to complete the application, or if they need additional resources? So those are the sorts of things I want you to be aware of and be thinking about when you're asking the safety concern questions, so that you may be able to offer any resources that they may need. And while today we're not going to be going over the details of trauma-informed best practices, if you've received training on trauma, being trauma-informed in your work, it's a great time to sort of apply those principles and practices as you work with folks who may have a history of domestic violence, maybe still in a domestic violence situation, and being able to talk about those. Deanna, is there anything else you'd like to add about the safety concern screening questions we have?
I'd say check in with your manager about how your organization handles it. You may have additional practices or guidance. And if somebody does have a safety concern, we have some resources for them. You need to know whether or not you're a mandatory reporter, although just because somebody reports something to you, depending on who they are, it doesn't mean you have to report it to authorities. But I would check in with your manager about how to handle that and get guidance from your individual organization.
Awesome, thank you. All right, escalation process. So what do we mean by escalation process? We mean that when you're submitting an application and there might be a challenge with that application, everything from this client needs to get coverage today, their coverage should have started sometime in the past, maybe the date of request needs to be changed because their coverage started in the wrong month and should have started in an earlier month. So I'm going to talk about all those things. I'm going to talk about the One Customer Service Center feedback template and the One Applicant Portal template issues. So these are all the things I'm going to talk about. And let's first focus on the client advocacy guide when it comes to escalation. So your getting started guide has the client advocacy guide. So like Deanna did earlier, if all of you can go to your client advocacy guide and find the page that has your, go to the getting started guide. And if in the getting started guide, you can type into the chat the page in which the client advocacy guide begins. I think every single person who is an application assister should have this at your fingertips. It may be one of the single most pieces of paper or handouts that we give to you, regardless of what training you attend. And so let's go a little bit into, let's see if I have it. No, all right. So in the getting started guide, let's see if I can pull it up real quick for you, because I think I have it open. Oh, yes, I do. Oh, no, that's not the one I want. All right. In the getting started guide, I think some of the single most important things are if you have an issue with a case that needs to get some resolution, your second page of your getting started guide is designed to direct you to email the most appropriate team for that issue. So I can't see my screen very well or in large, and so you can see that on here that we have Oregon benefits at dhsoha.state.or.us, and that is sort of the large catch-all for many questions that you may have. So you will see in the little gray box the different types of issues in which you would email that team, and I would use that as my guide. You're going to see in the subsequent 4 boxes below, there's a pregnancy request team, there's a newborns team, there's a corrections team, so justice involved team, and there is a refugee team, and then, and then there's a 5th box, there is one for tribal members. So if you're working with any one of these specific communities and you need help with that application for whatever reason, these would be the email teams that you would email in order to ask a question or resolve the issue that you may have. I will add that we want to make sure that when you email any one of these teams, because there can be large volumes that go to these teams, that you use the format that is on the final page, which is page 3 of the client advocacy guide, and use that as your guide. So it says, please use this suggested template for your emails. I often think about it as just the facts. So provide as much level of detail, but sticking to the facts. We don't need lots and lots of backstory. Just think if you were the person on the other end receiving the email, what was the information that you would need to provide enough background so that a person can reasonably go, I see what the issue is. Yes, we need to resolve this, and that they can go ahead and manage the piece that needs to be resolved from our worker side here at the state. These are great teams doing great work, and you should use them when you need to use them. So if there's an escalation, the application gets stuck for some reason, you've uploaded the appropriate documents, but it needs to get a review by a worker on our side, and you know that it takes maybe about a week for a reviewer to actually look at it, but they have an emergency medical need right now. Email the appropriate team here to say, I've submitted the application, I've uploaded the documents, they have emergency medical that needs to be dealt with right away, and that they can sort of pull the application and move it along in that process. And this is a document I, for myself, have printed out and keep it close to my fingertips so that I can use it if I need to email any of these teams. All right, retro medical request template. What is retro medical request? So basically an applicant can request retroactive medical benefits if they have medical bills from the 3-month period before applying for benefits. And then once they're approved, they can ask their provider to rebill to OHP. So you can see here the retro medical request template. It provides you with information about the template itself and the information that needs to be applied there. And so, you know, you might have a scenario where in the one system, the day in which the application is submitted in our system is our date of request. A date of request for us determines when we will start medical benefits. So our current system is designed whatever day in the month in which you apply for benefits, we start your benefits retroactively back to the very first day of that month. But the way the rules are written is when you make a request to start an application, that officially starts your date of request. So if somebody made the request to start their application on the 30th or the 31st of the month, but you can't see them till the first day of the month, technically their coverage should have started in the previous month on the first day of that previous month, which means also that any medical bills could be covered if they had medical coverage and would have been eligible, that we can retroactively cover those. So if you run into a scenario like the one just described, you may need to submit this form to ensure that all of those past 3 months, if they're eligible to have them covered, can be covered. And you would submit this form. I don't know if a lot of folks use that, but that type of scenario that I just described, I think often would be the scenario in which one might complete this. A date of request correction template. Let's see, retro medical request template, sorry, and this is date of request correction template. Sorry, I was sort of mixing these two up, and I was talking a little bit about the date of request correction template. Again, 2 templates, slightly different. One is requesting retro coverage, and the other is changing the date of request. So in essence, let me go back to this so I make sure that I'm covering this. If somebody has medical bills in the previous 90 days prior to coverage, and if those were OHP eligible services and they did not have coverage, we may be able to cover them through OHP. If we don't capture that information on the initial application, you can do it by using this retro medical request template and submitting that in order to ensure that those past bills can get covered. All right, the One Customer Service Center feedback template. Again, I feel like now it's like, oh, you should have this at your fingertips, but I don't want to say you got to have everything at your fingertips, but This is, again, one of those documents that I think is good to have at your fingertips. It's an email template for you guys as certified assisters. You can report coaching opportunities or like kudos, like great job regarding the one customer service center. And we want you to provide as much detail as possible. And here's how I often think about it. So we want to hear both the good and the bad. When you call our customer service center, I'm hoping that most of the time it's nothing but a great positive experience. But sometimes it may not be. And sometimes it may be that the person who answered the phone is newer. They don't have all the information. You might actually have more experience than them. And but something doesn't quite go as well as we would hope it. When you call, they're supposed to say their name. They're not going to give their last name, but they'll give their name. And should proceed with the call. If they don't, I would just make it a practice of always saying, once you started the phone call and they've picked it up and they didn't say their name, I would go ahead and say, hey, I didn't capture your name. Can you tell me your name? And then I would write it down. If they gave it to me, I would write it down because knowing me 5 minutes into the conversation, I might have forgotten their name already.
Yeah.
And then if there's any problem, one, you know the name of the person who assisted you, and you can complete this form. So whether it's like, hey, they were just amazing and you want to make sure that they get acknowledged, complete this form and submit it to us. Or if there was a challenge, to complete the form and submit it to us as well. And it provides us an opportunity to provide some coaching to staff who may need additional help and coaching or maybe training regarding whatever the specific issue is.
Yeah. And I'd even say, John, that I'd encourage people, like you said, to do that with every phone call. Start out filling this form in case it goes,
Yep.
one direction or the other. And if not, then
Yeah.
just cross out those names and replace them with others. When we get these forms, they're filled out by hand. They have notes. They have doodles. It doesn't need to look official. It just needs to have the information. So feel free to be messy about it.
Yep. And the truth is, we want our call center to be really good.
Mm-hmm.
And so this has been really helpful for us, I think, to be able to provide feedback to the managers there if there's trends that are occurring, because it's clear like certain information just didn't get to enough call center staff. It allows us then on the backside to, through our internal newsletters or emails, to remind folks about certain policies.
But we do have a point person on our operations team who reaches out to everybody for whom we get a coaching form. So it really does happen, and it does help improve the overall quality of the customer service center. So thank you for taking the time to do it.
All right, then there is hopefully you'll never have a one applicant portal tech issue ever, but if you do,
Like
if you're
today,
experiencing,
the applicant portal went down while we were in this training, but I think it might be back up.
woohoo! Oh my goodness. So if you're experiencing technical issues when you're submitting an application in the one portal or you're in there using it, we want you to use the template to guide you through the necessary steps to take. So, and these are all again in your getting started guide. So they're there. And it provides you with the steps to take if there is a technical issue. And the level of detail that that's in this guide is sort of like the information that we need to make sure that we can resolve it as quick as possible if there is an issue in using the one system. And sometimes it could be, it's our system, and this is the way we learn about bugs in our system that we were not aware of. And sometimes it might be a user error. Maybe it happens to be a browser and a browser version issue. So either way, it's a way for us to be able to resolve these issues for you. We are at slide number questions and answers. So let me throw it out there for any questions that folks might have.
I want to
I
answer
know
a
that
previous one. Oh, sorry.
Yeah, no, go for it. That'd be great.
So we had a previous question from the very beginning of this training, which was, is non-emergency medical transport covered for individuals on COWAM emergency only coverage? And the answer is no. So I would like to offer any corrections or clarifications from anything that might or might not have been said earlier. The answer is no, it is not covered for COWAM members. However, if somebody's on COWAM Plus as a pregnant individual, non-emergency medical transport, or NEMT, is covered. And emergency transportation, if somebody is on COWM and they end up with emergency transport to a covered service, that emergency transport will be covered when the billing is remedied, or it should be. I did want to wrap back around to that one.
Awesome. Thank you, Deanna. That is so super helpful. I think both you and I were not confident about our answers.
Right?
Yeah.
So, yeah, and then other than that, I know we've been answering questions along the way. We would like to open it up to any questions you have right now to put into the questions box. It doesn't even need to be something that was covered in this training.
Exactly. Exactly.
This is your time.
Yeah. Yeah. You're right. Exactly. You've got two rocks here who can help you out with any questions you have related to this work.
Well, what I will say while we're waiting for people to formulate and type in their questions is that after today's training, you will receive a follow-up email from me. And if you need, we do not give out certificates standardly, but if you need a certificate for proof that you've taken this training or for whatever other reason, you can let me know via email and I will send it to you. So just send me an email asking for a certificate and we'll make sure that happens. We do have a rights and responsibilities question. And is there an R&R printable form? Oh, I wish. Right now, we have to send you to these two different places to get the two different documents. We are working on, but it is a long-term project, of combining them because I would like to say that in the future, we would like to be able to offer a single document, and at this time, we do not have that available. But they are printable. You can print pages 11 through 16 to PDF or paper from the application guide, and you can print the 3 or 4 page NPP, or Notice of Privacy Practices, from that form. So you can print them. All right, John, are there any final words you'd like to share while we give people a little extra moment? Aha, here's a great one, actually. Somebody
Let's go
asked,
for it.
Blanca, you know what you're talking about here. Do we have the R&R for medical only? Okay, so the rights and responsibilities, when it's posted online, if you go to ohp.oregon.gov, you get the rights and responsibilities for all programs combined. It's extra super duper long. That's why we've been pointing you toward the application guide specifically, because that contains the rights and responsibilities for medical only, and it's significantly shorter, and it's only what's relevant to your applicants. So even though you can get the rights and responsibilities in other places, the best place to get them is pages 11 through 16 of the OHP application guide, or in the applicant portal. It actually, if somebody's following along on the applicant portal screens, it's peppered in there, here and there, and by the time you get to the end, if you've read it all, you have looked at all the rights and responsibilities. So the applicant portal is the other place where it is contained. Hopefully that is helpful. And here's another question. Is the standard procedure for a family with at least one COWM eligible member still to follow up with the processing center to set up an interview to confirm information? I feel like that might be mixing a couple different topics. But John, do you want me to address that, or do you want to address that?
Go ahead, and then I'll add if you want, unless you want me to address it.
Okay. Well, when people apply for medical coverage with you in the applicant portal one system, they're applying for MAGI and non-MAGI benefits. And those different benefits have different eligibility criteria. Some of them look only at monthly income or yearly income. Some of them also look at resources and assets. And any of the programs, the non-MAGI programs that look at resources and assets, may have an interview that needs to be conducted in order to award those benefits. That interview, those non-MAGI benefits, also have available full OHP and COWM. So somebody applying for medical who is an immigrant and is eligible only for emergency level may end up with non-Magi Callum benefits, for example, if they're 65 or over, in which case they may very well need an interview. And community partners can help applicants and clients set up an interview with the processing center to complete that application process. You're welcome to. We actually have a whole guide on that. I don't know if it's in our Getting Started guide. Maybe you guys as community partners can look in the Getting Started guide and see if there's a guide to assisting applicants with setting up an interview. We created that resource. I just don't know where it is.
And if I was to, it's a great question. If I was like to keep it simple in my own head, basically, if you're an adult who is not over 65 or is not disabled, and you're applying, you will not have to go through that interview process. If you're eligible or a verification, you'll simply need to answer the questions on the application and you'll be fine. If you're 65 and older and do not have an eligible immigration status, then yes, you may need to go through the interview process. And that would be because you're 65 and older or disabled and do not have an eligible immigration status.
Yep. But the applicant portal will tell you if they need an interview or not. And if they do, it will give you instructions. And you're welcome to help them set that up. Absolutely. All right. John, do you want to read any other questions we have in the questions box?
Sure. Okay, you answered that. Do you see community partner helping with other benefits such as food stamps? A great question. So currently you're able to help in the one system simply for medical benefits, whether it's Magi or non-Magi medical benefits. Although the one system can do many other things to determine eligibility, ERDC, TANF, SNAP, etc. Currently, you will only be able to do the Magi and non-Magi. I know that there is discussions to have community partners be able to assist with other things such as food stamps, etc. But at this point, we do not have a date when or that might happen, and I think it's still a little bit off. We would probably, if we do it, we'd probably allow community partners to choose whether they want to assist with those additional benefits or not, because some might want to and others may not. So, but right now the answer is no, but it's not a closed door.
Definitely not a closed door. Discussions happen.
Yep.
If you would like, let's see. There is a question here about what email do we use to get a certificate. You can email me and I will put my email in here and I'm going to send you a follow-up email and you can reply to that and ask for I can't type my email and type at the same time. You can reply to my email and ask for a certificate, or you can send something to the one I will put in the chat box as soon as I stop talking.
It's like, can you walk and chew bubble gum?
Apparently not.
Probably, yeah.
Well, multitasking, I have learned, is one of those things that decreases as your age increases in my universe. So.
Yeah, those numbers collide.
They're inversely proportional.
Yeah. All right, if folks have any questions, now's the time to ask them. Otherwise, we'll start to wrap up for you. I would say thank you for being here today. We've got about 60 people on this call today on this webinar, so I really appreciate all of you being here. I want you to know, like we say this all the time, but your rocks are there to help and assist you, so please reach out to your rock if you have any questions whatsoever. And if you can't get a hold of your rock, they're out or something, you can always reach out to one of the other region's rocks. It's not a problem at all.
All right, thank you everybody for being with us today. This concludes your recertification training for your OHP assister status. So thank you very much. And Shamika, you have a question there that I don't quite understand. So if you can reach out to me directly, that would be great and we can address it.